How did you start your journey, ma'am?
Like dental journey or my journey?
Dental journey.
Dental journey.
We'll start from there. About how sir had supported you.
Yeah.
So I'm very, very curious to know that. How did you met sir?
Yeah, it was a very, people will laugh at me now, maybe, hope. He was my internet friend.
These days, the relationship, like people really move on very fast with the relationship.
Yeah.
People have a lot of options these days, right?
Nowadays, if you see either boy or a girl, everybody wants to know everything in a high range only.
Yes, that you mentioned that you had to struggle, and you also mentioned that.
But I used to go on the terrace and I used to cry. So it was very sad actually. Now people ask me like, why are you doing this 1 rupee consultation? Why are you giving a discount for females? Because being a woman, I know that pain.
Correct.
So I don't want any other woman to suffer like that.
Right. What is the other profession you would have chosen?
I really like a fashion or boutique kind of thing.
Wow. Oral health can also cause mouth cancer?
Yeah, exactly.
The mouth smell a lot, right? Why is the smell coming and where is it coming from actually?
Yeah, there are many reasons for halitosis also, because not only this calculus and tartar causes the halitosis.
Right. You tell in the video that in 30 minutes you can have this better smile. I'm like, I spent 2 years and how come it is 30 minutes? I couldn't believe myself.
Actually, see, this one anybody can do it. Teeth gap filling, generally we used to do in the earlier days composite.
So ma'am, this 30 minutes, the treatment that you told, right? When did this all start, ma'am?
No, this I'm doing almost since more than 10 years.
And I have heard that Coca-Cola can melt your teeth.
Exactly.
So people are using those kits to whiten their teeth.
No, I literally strongly, I will say no for all these things.
Ma'am, personal question, who proposed first? Ma'am, welcome to Sujata's talk show, ma'am.
Thank you so much.
How are you feeling today, ma'am?
Excited.
So, ma'am, to get started, firstly, I'm super inspired with your journey, but I really want your journey to be passed to many people. So, I want to know that how did you start your journey, ma'am?
Like dental journey or my journey?
Dental journey. We'll start from there.
Yeah, actually I finished in 1997. Since then I used to work actually. Then I got married and moved to Hyderabad in 2000. And then I started working in few clinics actually with my very good mentors. So yeah, it was like that. Then after marriage, due to some financial issues, openly I'm telling you that.
Right.
So I moved to Jeddah actually, and that time my son was 13 months old. So thinking that they'll come in 1 month where, it was in 2003. So the things will not happen what we think. So then I had to suffer very badly over there, and I came back to Hyderabad. Then again started working, and then I thought, okay, this is not my life and I should do something else. Then in 2009, I started my own brand, Vijay Dental at Chikkarapalli, Hyderabad, with a very small clinic with a single chair. And now we have around 3,500 SFT and with 18 members of team actually, all women's.
Wow.
So I just wanted to make sure I am supporting women, especially because when I was in trouble in Jeddah, the one Telugu family helped me a lot. Her name is Sangeeta Garu actually. So thinking they thought I was a woman and alone I came and I was suffering, not even having a food there. I used to just, have 1 bread per day there.
Oh my God.
So in that case, they helped me and they helped me to come back to India. Then I thought, okay, I should take care of my other people also like this. So that's it.
Ma'am, in 1997 you started your journey, right? And from there you went alone to Jeddah.
97 I finished my BDS, and then 2000 I got married. So 2003 I went to Jeddah.
And you went alone?
I went alone, yeah.
And you also, I heard that you also had that emotional journey in the flight, right? You were crying.
Because I was a only daughter and very much pampered. Never used to go to the next shop also. It was that kind of a thing.
And now you traveled alone to Jeddah, right?
Wherever. Yeah, my husband is very much supportive. Right. And all these things happening just because of my husband, I can say. Really, people say, there is always a woman behind a man's success. But I say, for every successful woman, there is an understanding husband.
Wow.
Which is very, very important actually. And when we get that support and all the encouragement, we can really do anything and everything.
Right,
And that really I've proved, because
Right.
many junior doctors and many female and many especially women I'm encouraging,
Right.
and they do text me like, madam, you are my inspiration, how do you manage your time? Now I'm almost about to turn 50 now.
Wow.
So at this age also you're going here and there and all.
Right.
So I just feel like, where there is will, there is a way.
Right.
Yeah.
Very true, ma'am. Ma'am, with that, when you told that about how sir had supported you,
Yeah.
so I'm very, very curious to know that how did you met sir?
Yeah, it was a very, people will laugh at me now, maybe, hope. He was my internet friend. So, those zamane mein na, it was not like this chit chat.
Like we had internet back then? Like,
Yeah. Nowadays, all fake and this thing. Na, but that time, I didn't even see my husband till we got, it was fixed almost. So I don't know, somehow I just liked him. I used to chat with him actually. Those days it was MIRC, the only one chat center used to be there in 1999 and 2000 ke time mein. So we used to pay 60 rupees per 1 hour internet.
Oh.
Internet browsing. Nowadays it's very free and all.
Right.
So I didn't even see him. Even he didn't saw me actually before we got this, we should get married.
Wow.
And then once we were confirmed, then he came with his parents to my place, and my parents went to their place, and then it was formal.
That's when you saw sir.
Yeah. The first meet, Pelli Chupulu, was that time I saw him actually.
So, like, ma'am, these days the relationship, like, people really move on very fast with the relationship.
Yeah.
People have a lot of options these days, right? But no, having this love story where, you have not even seen your partner and then you got married and now, he had supported you to be wherever you are today, right? So, what is your recipe for successful
I feel
marriage?
always, trust is the main
Yes.
thing, and demand. Nowadays, if you see either boy or a girl, everybody wants to know everything in a high range only.
Yes.
Nobody wants to compromise or nobody wants to adjust. Everybody want everything. Kitna rupai hai, ya kitna makan hai, and how much you are earning and how much what you are doing.
Right.
So I never had that sort of thing. Only one question I asked to my husband, like before marriage, nannu baa chuskontawa, like will you look after me like nicely, like so nicely in the sense what. Taking care,
Proper care.
talking properly, giving his time.
Respect.
That's what I asked. I didn't even know how much was his salary, what exactly he does. Even I didn't know. That was the thing. But he was aware. Like even I was like that. So he thought like doctors say the pause rehte hai, like that. But I was not that kind of girl that time. So always putting 2 flats with full of oil and all. So I never thought like he will like me and. So I don't know. Like we used to chat actually, not even a phone call. We just used to type and chat. So with that we got connected.
And that to 1 hour.
That to 1 hour mein, like weekly once only I used to chat. Only Saturdays I used to go. That because like when I used to do my internship, all my friends were in other states. So that time there were no phones and all nowadays. So we used to like chat. Everybody used to come during that time and we used to chat. So during that time he got connected to me actually.
Wow.
Like that. And now then like people ask me like how did you dare to get married? I don't know. I just trusted God. I don't know. Like whenever I used to chat with him, I used to feel okay, he's the right person. Like the way he used to, caring, the talking and all. And that's what girls should need. The very caring husband is there. That's enough actually.
Yes.
Whatever you want, you can do.
Right.
And when we got married, also yes, of course, they agreed. Parents agreed, but then like it was like an exam for us. They didn't support us financially, and even passing out of the BDS in 2000, my salary was 3,000 rupees that time. Starting salary. So he was also earning. He was a freelancing actually he was doing. So hardly parents, both the parents were like, शादी हो गया, अब बस आप लोग
देखो.
Yeah, because you liked and you got married and we'll see how we are going to survive. It was like an exam. Every day was an
very
exam.
challenging.
Very challenging. And but we never felt like we are struggling. We used to enjoy each and every day, even though we used to get 1 kg rice per day or 2 rupees mirchi we used to buy. Nowadays we are buying a bags is a everybody can buy, but that time was not like that. So but then like we were really used to enjoy those days also. Going for a movie weekly once we used to go.
Wow.
We had just a normal scooter or city bus, maybe we have traveled a lot. But now the things have changed. Now people when they see me they feel like, oh madam itna patient hai, like she's earning good, that this and all. But this is not a one day journey, it's not a nightmare. It took almost 25 years for us
25
to
years.
get this. So the people used to tell us slow and steady wins.
Right.
So this is also like that. You should have patience in all the things. But nowadays girls, no, suppose even for dentists also, I mean not only dentists, any business, if you start today, they want immediate next day 1 lakh aana hai, itna aana. Like otherwise they go for depression, they go for suicidal attempt. Nothing, whatever you want, how much ever is there, how much you're going to eat. 3 time food you should have. अच्छा पहनने के लिए कपड़ा होना है, रहने के लिए घर होना है. कपड़ा मकान और बोलते हैं ना कुछ.
हाँ, कपड़ा मकान.
हाँ, और एक चीज है.
और मैं भूल गई.
What is that?
सो एनीवेज मैम आगे बढ़ते हैं. मुझे भी याद नहीं है. सो मैम रियली नाइस टू नो कि एक रिलेशनशिप को किस तरह से हाउ यू कैन टेक केयर ऑफ इट एंड हाउ यू कैन एक्चुअली इफ टू souls are together you can win the world is what you say.
No, we all are together, my in-laws, my parents, everybody, we stay together. All like a good family, good healthy family actually.
Very nice, ma'am.
Very happy family now.
Wow. So, ma'am, coming back to another thing, ma'am, so that you mentioned that you had to struggle, and you also mentioned that from there to come back to India, you had that one Telugu family who helped you out. You are still in touch with them? Ma'am?
Yeah. I'm in touch with them, and they stay in Hyderabad only.
Wow.
So they had.
And tell me more about it, ma'am. What happened
actually, there once, the travel agencies and all, they used to send giving a visa and all. So what they promised me is like once I go there, I can call my family within a month. So I thought, okay, 1 month is not a big deal, so I can manage for 1 month. Anyway, next month my husband and my kid is going to come to my place. But once I go there, it got changed. Arab countries, that time Jeddah, it was not like this. It was totally restricted, and wearing that abaya, like burqa. I had to wear burqa, and I went there. It was a typical, they'll take out your, they took up my passport in the airport itself.
Why?
So that's their thing, once you go there in the reach the airport, there'll be one big room with no window at all. So one small kindi, very small hole. The one person they'll come and call, kafil they used to call, the owner. So once they come, they'll send you out. Then as soon as you go and meet, they'll ask passport. So once you're given the passport, gone. Then like that, then I went there, and first it was okay, but their partners had some issues. So they closed the hospital there. And because of that, my Ikama got delayed, and they said like you go and search a job. And for 3 months I was okay. They were telling like, okay, next month aayega. So I was waiting for that next month. We used to go on the terrace, and I used to wait like when they will come or when I'll go to India. And there was a time I thought like I may not come to India at all. I'm not going to see my son also.
Oh my God.
Every day was a crying
And as a
thing.
woman who never went to nearby shop, she's alone in Jeddah.
I went. I never went alone to Bangalore to Hyderabad also. Somebody used to come with me. I was the only daughter, so very much pampered. Same way, my husband also very much used to pamper me. Other than that, then there nothing was there. No friends, nothing. It was to be very. What if I don't go to India? Like when I'm going to, every day was crying. But I used to think like if I tell this to my husband, they'll feel bad. They'll be worried. So whenever they used to call, I used to tell them like I'm busy now. I'm with a patient like that. So I used to avoid all these things. But I used to go on the terrace and I used to cry. So it was very, very sad actually. So then somehow one family told like one doctor is stuck in the Saudi, and Sangeeta garu, Ashok garu, they used to stay nearby to our premises. So that day only they came to me. What happened? I heard like you are in a trouble. I said yeah, I'm in a trouble. Then they
So
got
they were
the
there
food and all.
only.
Yeah, they were. They settled in Jeddah only. Now they moved back to India, Hyderabad. So they become very close. And once actually, like in search of the job, we went to the job actually. We used to go and beg for the job, literally. Give us a job, some job at least. So there, one person like he was from Kerala. See, there here in India we fight, caste, religion, that, this and all. But that person was from Kerala. He just asked my name and I told like I'm Dr. Vijay Lakshmi. He said, "Are you from India?" Yes. So he asked me like, "Did you had your food?" I said like, "No." My colleagues were like, "Madam, what are you telling? Don't tell like that." I said like, he asked me that, "Did you had food?" I said no. What is wrong in that? Because
yes.
I was literally frustrated. You give job or at least give me food like that. That was a stage actually. So then he told like veg or non-veg. I was a pure vegetarian. I said like vegetarian. When that doctor, "Madam, what is this?" I said, "Arey Baba, what is there in that?"
Yes.
So baat to karna padega because I was the only lady doctor, female doctor. So then they got us for me vegetarian thali. You believe it or not, how they show in the movie that like that I had a food because it was been like 1.5 months till they have a proper food, rice and all. So now that's why I, whenever I go, I feed people and during Corona also.
Because back then you were craving for food.
Yeah, I
And
was
on
craving for
one
food.
bread you
Yeah,
have also
without
lived.
only one bread per day because one samoli they used to call. It was one, one real. One tea you used to keep for one real. So one tea I used to drink for 3 times, half karke. It used to be like that. And just if you feel hungry, drink water. That was the only thing. So if I tell to my husband, maybe even he was helpless. He don't know what is happening over there because the phone calls were even incoming were chargeable those days. So it was very tough. Like I was just praying God. Yes, I had one hope. Like at least once I want to meet my son and my family before my death. It was such a horrible situation, and that day maybe see the God will not come directly, but He'll send somebody as a messenger, no?
Yes.
So like that, maybe these people came to me with unknown people. They don't know my background. They don't know my like past history. Nothing. They just came and they had a small kids that time. Because they know. I mean nowadays the relatives are going, but then like nobody used to go there. So they felt okay, auntie like that. They used to call me and they only provided me then coming back to India like visa and all. Then I came back after 9 months.
After 9 months. So entire 9 months was a
Entire
big
9 months
struggle.
I was a very big struggle. Then after coming, I told my husband, I'm not going to anywhere without leaving India. To मैं बाहर ही नहीं जाना है. Even now, if I go to out, I mean anywhere abroad now, if I go to immigration, I don't know, somehow I get a shivering. Even my husband is once my husband was coming from Shanghai to Bangkok. He asked me to come with my kids to Bangkok. I was like, no, I will not go. That was the first time I traveled after almost 10 years. Still that trauma was there. I was literally shivering. My son was, "Amma, what is happening for you? What happened?" I don't know better. Something is happening for me. I got so scared to cross the border. So it was a very sad, but now no, everything is good, everything is happy. That's why I take all my staff via like with flight journey. So everybody should enjoy their life. We don't know how long we are going to stay, but as long as we are there, we should be happy. Make others happy. You will be more happy actually.
Right. I can see that love that you give to your staff.
Yeah. My staff.
Every day, you really love your staff.
Yeah.
Right, so
I always address them like my amma, like pillalu. So
like your
whenever
own kids.
some strangers see me, మా పిల్లలకి కావాలి ఇది. పిల్లలు means they think my son. I say మా పిల్లలు అంటే మా staff పిల్లలు. So wherever I go, I take them. And all female staff I got. We really enjoy the work atmosphere now.
So ma'am, people also need that space to enjoy and work and all of that. So I can really see how much you love your entire staff. So ma'am, and also your journey, like how you actually stayed there for 9 months was not easy, right? But did you had a suicidal thoughts there when you were there?
Not suicidal thought. No, I never had that because I'm against for suicidal thoughts even now. I used to, I don't know, like even from my student time also, I used to encourage people, give always positive thoughts. Whatever the thing, take it as a positive thing. Whatever my situation, something is happening, maybe that something good is about to come.
Right.
Like that, I used to give example. So never, but I just had one hope. Okay, one day will come. Maybe something is going to, the miracle is going to happen.
Right.
But how it's going to happen, it was unknown.
Right.
Every day was in hope, when the call is to come, what to talk now, how to talk, because I never used to share all this to my husband.
Right.
And even the way I came to India also was, I didn't inform my husband also, because there once they give, these passport, they don't give a passport generally. I mean the visa also. The Sangeeta Garu, I told na, her husband, they got me the visa and exit re-entry. So they gave me on Wednesday and Thursday was my flight. But they told me like not to inform anybody because they might stop you anywhere. So then I was so scared. I just came with a handbag. I didn't have anything. And in previous day, they only took me to the shopping mall. They asked me like, what do you want to buy, something for your. They only gave all money to my to buy cloth, and I told my father-in-law I took one finger ring. Because they're very sweet. So I was about to ask. No, they only told me you buy something for your in-laws or parents. I said like no, for my in-laws I'll buy. So but see, even the people, they don't know whether I'm going to return the money or where I'm going to go. But even then, without knowing anything, they help me a lot.
Right.
But once I came back to India, of course we send the money and all. That's a different thing. Even now they are in regular touch with us and the kids and everybody. So that's the thing. We don't know where people are going to help us out.
Very true, ma'am. Very true.
Yeah.
And
While coming to the airport also, they were telling me, madam, like don't tell anybody, like going to airport. So I took one just bag and hospital mein I told I'm just going to Sangeeta Didi ke ghar ja rahi hu. They were like okay, because next day I'm going to come back. I never went back again. So then from there, when I was sitting in the flight, it was an emergency exit. It was so, emotional that day. The air hostess come and she was trying to tell me it's an emergency exit. Do you want to shift the seat? I thought, okay, she's asking me to get down from the flight. I was so fixed like that. I started staring at her, what happened. She was like, emergency exit. I said, I'm comfortable. Then Sangeeta Garu called, like, you better switch off the phone and relax, nothing to worry. Once I reached Mumbai, then I called my husband. I'm in Mumbai now. He was shocked. What happened? Suddenly we came. I said, like, in 1 hour, I'm got a Hyderabad flight. I'm reaching around 3 o'clock. You come to pick me, I'll explain everything. Then I told, I'll never leave and go now. So it's struggling alone is a very difficult thing. That is a positive thing. Have some hope. Suicidal nothing is going to see. Now I'm alive and I'm able to prove myself. Maybe the day I just waited for 3 months, 4 months like that. The one day came. Yeah, there was a right way to go out and explore the thing. Maybe what he told many people. One day I thought like, what is my life? Why I came to this place? And it's mainly for financial struggle. Now people ask me like, why are you doing this 1 rupee consultation? Why are you giving a discount for females? Because being a woman, I know that pain.
Correct.
So I don't want any other woman to suffer like that.
Right. I'm I'm so much touched now, and I'm really, really honored that you're here. So, ma'am, it's absolutely fine. So, ma'am, my next question, like this entire theme of the podcast is also untold truth. So, I'm gonna really ask you more of a question about your dental journey. So, firstly, your personal journey was very inspiring, and wherever you are today, it is all like you have had that dedication, you had that commitment, you had that positive mindset to move forward despite all the challenges. So. You have been a real fighter is what I can say.
Yeah.
So, ma'am, on the other side, when it comes to your dental journey, so why did you choose to be a dentist? Like, what is it because like you chose it? You had a passion for this, or what?
Not exactly, because I studied from Bangalore only. Like it was a PCMB, like MBPC. So I did my BTech for 1.5 years in BMS college, and then it was my dad, my appa's dream, like I want to be a doctor. So he always gave an example. He was never happy when I joined for BTech. He always used to taunt me.
So you joined BTech first, and then you.
Yeah, I did my till 3rd semester exam. Also, I wrote in my BTech, and then I joined dental. So my dad was, I don't know what made him to think. He was like, no, the prefix has to be there for a girl. Like doctor, it gives a a superpower like that. He used to give me all examples when every time he used to come, though their daughter got doctor, medical or dental, veterinary, whatever. But doctor should be there. Whatever you do, he used to give me a simple example, which really I liked it a lot. But nowadays, many people, they do some this thing and all, they give doctorate, but that's not the thing. So I mean, if you do, for example, I was a BPC student, so it's mean like if you do BSc and then MSc, then PhD, and then you're going to get a doctorate. If you do this BDS or any other course, shortcut beta, you kar dena bas. Like that used to motivate me to at least go for something, get doctor. So that made me, but I was not ready for medicine actually, because somehow I don't know, I used to feel always medicine is very tough.
Very tough. Yeah.
So I don't know what made me to think of dentistry, and it is not generally whenever people go for BDS, they say they're in a medical and they chosen this BDS. But I know I optionally I took BDS actually.
Right.
So I just wanted to do something in dentistry like that, and of course I'm doing it now.
Right. But let's say that if you were not a dentistry, what is the other profession you would have chosen?
I really like a fashion or boutique kind of thing.
Wow.
Because during 10th holidays, everybody used to go for these coaching centers. I went for tailoring.
Wow.
I used to stitch myself and something like that.
Wow. That's amazing, ma'am. And ma'am, on the other hand, when it comes to the oral health as a dentistry, so I'm sure like there are a lot of patients you have seen, and there are a lot of patients you have treated. And oral health is very important, which people neglect.
Yes.
Right. And oral health can also cause mouth cancer.
Yeah, exactly. Because see, oral health first now immediately it doesn't cause any cancer, but the thing is negligency basically. Suppose any sharp teeth is there, sharp teeth, any broken tooth in the backside, it causes an ulcer. They keep on biting their cheek, so unknowingly it becomes a non-healing ulcer, which will turn into a carcinoma, cancer.
Oh, that can be a cancer?
Yes, that can be a cancer. That's any sharp tooth. Like that. And nowadays oral health is very, very important actually, See, suppose you are into a businessman or you are into a very entrepreneurship, you're very much in a very good deal, you're talking to an opposite person. If you're stinging, if any bad order is coming, you won't be confident to talk first thing. Neither the opposite person will not listen to you.
Yes.
So there you're losing your business or whatever, the deal, whatever. So it's very important actually. And that's why the people used to tell in the olden days, oral health is overall health.
Wow, that is a good line.
Yeah. So nowadays all these scans and all, earlier they used to see eyes and they used to open your tongue, they used to seeing your tongue, even seeing your gums. See, even for myself, I don't say I'm a great thing, but many people come for dental thing. We have told many people like, they are diabetic without seeing any reports.
Like
looking at their gums, looking at their gum condition, you can say they have a diabetes, and first they fight with us. Madam, I came for gap filling. You are telling me to go for sugar test. Why it is? We will know. First you get sugar level done, then we'll see. It will be around 300, 400 post lunch. Then they'll come, oh madam, really it's very much chala thanks, and నాకు తెలియదు షుగర్ ఉందని చెప్పేసి. They feel very happy when they know like that. So like that many things can be detected via oral cavity. Okay.
Oh, wow, ma'am. And on the other side, when it comes to sugar patients, so when you're actually treating them, so I'm sure that they face more challenges than any other people.
Exactly.
Right?
Be more careful actually, because
have to be more
when they have a diabetic patient, they have these spongy gums.
Yes.
So whenever they, split also, the blood might come out. But because the blood is coming, they can't brush properly. So they reduce the brushing technique or brushing habits.
Right.
So slowly whenever they reduce that, the tartar is going to form. Whenever the tartar is going to form, the gums are going to recede. Whenever the gums are going to recede, there is a bone underneath. The bones start resorbing. So once bones start resorbing, the tooth start getting the gap and it start moving. Even then the patient doesn't come to a dentist. They feel kuch bhi nahi ho raha hai. But when literally it starts shaking, then they feel what they say, like, I don't want to remove tooth, please save it. But nobody can save it. They will tell, like, remove the teeth. So like that. So initial every month checkup or regular checkup can avoid all these complications actually.
Right. So, ma'am, people say dentistry is very expensive. So, do you really think that it is expensive, or
people
it is
are,
because of the negligence it becomes expensive?
See, negligency causes the expensive things actually, because when you go for regular checkup, what will be the consultation charges depending on their again their degree or whatever their area. The consultation they may charge. They may charge for scaling, which will start at approximately 1,000 rupees
1,000 rupees.
onwards, or filling also maybe 1,000 rupees.
Right.
But if you don't go for cleaning, what I mentioned now, the gums go down, then they go for deep cleaning, or else they go for root planing, or else they go for Lenap treatment, or they go for flap surgery.
Yes.
So it's going to multiply actually.
So if they negligence, if they neglect, so if
even
they go
small cavity filling can save a lot of money when you get it filled. But when you don't go for a filling, it will go for then root canal, then again going for the cap. So again you are putting more money. Sometimes there will be a cavity between two teeth. It can spread to the adjacent tooth. Like that, because of one tooth, it can be multiple teeth. Then again money is going to multiply.
Oh my God.
So dentistry is not expensive. Negligency causes dentistry expensive.
Very true, very true. So, ma'am, when it comes to you were talking about the odors that people smell a lot, their mouth smell a lot, right? And it becomes like it's not a good impression. Let's say that someone is an entrepreneur and they're smelling a lot, so it's not good. So why is this smell coming, and where is it coming from actually?
Yeah, there are many reasons for halitosis also, because not only this calculus and tartar causes the halitosis. Suppose if the person is acidic, acidity is there, even they they have their bad breath. Even the person is diabetes, when they have the bad breath. Even if they have any lung diseases like bronchitis, any lung diseases, even they have the bad breath. Like that, the multiple reasons are there. Even if you observe a simple technique, I'll tell you. Whenever you're fasting, you don't eat anything. You see in the night your mouth really stings.
Yes.
Because whenever there is not hydrated properly, whenever you are fasting, too much of long gap for the food intake, automatically the bad smell will come. The people will say, Madam, I'm not eating only, why my mouth is stinging? Because you're having the self-cleansing action is reducing there. That's why. Sometimes people will have a cavity here one side, they don't eat on right side, they eat only on left side. Then the tartar will form like a band. Even they till I'm not मैं खाना ही नहीं खा रही हूँ, क्यों इतना calculus tartar है? Because self cleansing action नहीं होते हैं उधर. Then it causes the too much of tartar formation, which causes the bad breath. So there are many reasons for the bad breath actually. So when the patient comes to us, so recently one patient came to us and she had a lot of gum bleeding was there and too much of bone loss. The age was just 23 years. So we don't know, somehow we got a doubt and we advised her to go for a complete blood picture. Her hemoglobin level was 5.5 grams. She was shocked and she is telling, no, you आप सर्जरी कर दीजिए, मुझे कुछ भी नहीं होता है. ऐसे करते और ब्लीडिंग होता है, we should not do it.
Correct.
So sometimes people will think unnecessarily वो टेस्ट लिख रहा है.
Right.
So whenever we get doubt only, we can write.
Correct.
So there are many things, that's why many people, whenever we choose BDS or even now, I don't know whether, because when we used to study, it was there. So BDS, अरे BDS में क्या है, वो दांत के लिए इतना क्या पढ़ते हैं? So they never treat BDS people as a doctor at all. If you agree it or not, they don't treat. But only when you get a teeth pain, you will know how important it is. No AA can replace a dentist. That surely I'm telling you. Even the pain, whatever you have, you can take some homeopathic or Ayurvedic, whatever. If the cavity is there, the dentist has to fill it. Dentist has to do the scaling. You can't do cleaning by yourself at home, sitting at home. They have to go for cleaning a dental chair only. Or if you want to replace the teeth, no homeo medicine, no Ayurvedic medicine can replace your teeth. Some miracle can happen. The dentist has to do the treatment. So dentistry is, that's why 5 साल में हम इतना पढ़ रहे हैं, तो imagine how speciality we're doing
how
there.
Much,
How much important it is.
Yes, very
okay,
true.
It's a super specialty. I feel, say, what is BDS? Bachelor of Dental Surgery. So we are specialization we are doing actually.
Right.
So never underestimate the, even people also who are studying dentistry, they feel हाँ बस BDS कर रहे हैं, क्या करना है? अरे बहुत सोच करना है आपको, बहुत है करने के लिए.
Very true, very true. So, ma'am, when it comes to this smell thing that you told, right? So, it occurs because of multiple other things that you
Yes.
told until now.
Yes.
So, people, to avoid that, people eat pudinas or they
Yeah.
eat some jeera, mouth
Refreshment.
freshener.
Yeah. Yeah.
So, does that work?
Yeah, that works, for temporary thing. Okay, suppose if you're not taking bath for 10 days, you're just applying perfume. How long are you going to
Which is gonna
keep
last for
healthy?
4-5 hours.
Yes, exactly.
Uh,
So the maintenance is very important. As long as your tartar is inside, your calculus is inside, nothing can give that no fulfillment. So visit your dentist once in 6 months, where you can really maintain a very good oral hygiene. Then you can avoid lot of problems actually.
right. Yes,
And
yes.
nowadays, like people are becoming more conscious about their smiles, and because of selfies and all,
Yes.
everybody wants to look better and
Yes.
good, right?
Yes, yes.
So automatically, the people are coming rather than cavity filling. Now they're coming for gap filling, or smile black gums, like the cosmetic thing. They're
Right,
coming. They're
right,
putting
right,
more
right,
focus
right.
on those things
Right,
nowadays.
right, right. Ma'am, when you told about gap filling, I really like you treated me like you are my doctor.
Yeah.
So the first time that I saw you on internet, because I had braces for almost 2 years.
Yeah.
The metal braces, and after that, still after when I removed it, they told me to wear retainers, and then I wore that, but maybe when I removed that again, it started pushing it front, right? So after, like, I was again searching for the best doctor who can help me out in that, and I found your video unexpectedly, and I'm like, you tell in the video that in 30
30
minutes you can have
minutes.
this
Yes.
better smile. I'm like, I spent 2 years, and how come it is 30 minutes? I couldn't believe myself.
Okay.
And I was like, कि अरे एक बार जाके मैम से बात करते हैं. तो I texted you and you told, yeah, it's possible. And then I spoke to you, and you like, there was a wonders. Like, I have seen so many people getting their smile transformation done, and it actually brings lot of what do you say, the happiness that I've seen
Confidence
on
in
their
their
confidence,
smiles.
the happiness that I've seen people coming in from various different countries to
Yes.
meet you as well,
Yes.
right, ma'am? So, ma'am, when it comes to gap filling, like, how do you do actually?
Actually, see, this one anybody can do it. Teeth gap filling, generally we used to do in the earlier days composite. Now I'm using Empress, it's a bit expensive material actually, just to close the gap. It's a very simple technology. So when do we, it's not for all the people actually. So please remember this. Suppose the girl is getting married, or I'll get a more of the movie or serial actors
Right,
and all.
right.
So they'll be having a shoot, and that
Right.
gap will make them not to open the in front of camera. So they become more conscious. So in that case, they want the immediate solution, because these aligners or braces will take bit time. Time taking.
Yes.
So in that condition, what I thought, I don't know, like, okay, let me do, karke, we just tried it and it got clicked. So even now any dentist can do, but I don't know why people are not going for it. When I'm really wondered, at least seeing me also they can
Right,
go.
they can go,
And
right.
instead of going for that treatment, even I don't know whether to say or not to say, few dentists will ask me, like, did you follow this technology? Did you follow what is the measurement ratio and all? अरे बाबा यार, और समटाइम दे फील लाइक हाँ इससे अच्छा भी हो सकता है, ये
Right.
उतना फिनिशिंग अच्छा नहीं है.
Right.
They'll try to comment.
Right.
So what I tell is, you do the work, you do your work, and you please put it on the, see, social media
Right.
is not only for me, it's for everybody.
Correct.
I'm
Correct.
I'm not doing some extraordinary things
Right.
by hiring somebody or giving
Yes.
to some company, nothing.
Yes.
I'm just posting whatever I'm doing daily. So that got hyped actually.
Correct.
So because people are there, if they want an emergency. One recent this thing I'll tell you. One girl came, they got engaged, and she didn't even smile for a photo.
Oh.
So the one from the boy said, they were commenting, I think the girl is not happy with this marriage. Maybe she don't like this boy, like that comments. So they got they called that girl and they said, no, I have a gap, I can't smile. So therefore, see, nowadays the
Right.
पुरोहित का बाजू में लगाते हैं, फोटोग्राफर का ही सुनते हैं लोग. So she was not at all smiling at all. So that couple, they both her in-laws said, her parents said, they took, they got her to me. They said, like, बस इनको शादी में हंसना है, बस ये क्या करना है करिए आप. I just asked her, like, what is your problem? She said, like, I have a gap. So like college में they used to tease like friends. What they used to tease, we can put one 5 rupee coin inside. ऐसे लग रहा कि कैनाल के जैसे दिख रहा है. So that was, she was so conscious to smile, so she never used to smile. So I told, okay, but Abhi, suppose if I do you smile? She said, yes, of course I'm going to smile, madam. And now they got married, and they send me the photos also. Madam, we are so happy. See, this, it looks very silly thing actually, but which will impact a lot. So like that, there are many people who want an immediate solution. Right. So we tell this is the gap filling is a temporary one. Right. Those who want immediately, where they don't have time for the aligners or the braces, or they can't afford for aligners or braces, if they want the immediate solution, yes, you can go for it. Like that, we have done for many celebrities and many smiles. I can say like more than thousands or 10,000. I mean, I don't know, every count also. That much smiles I've given. And everybody is happy. It's like, I don't want to impress any other dentist here. I want that person to be happy on that particular occasion. Yes. And one more example I'll tell you. One guy, he was attending a US visa interview, 2 times got rejected. I don't say like I did filling and he got visa, but that's what he told me. So third time he came to me like, tomorrow is my visa interview. One of my friend gave me a reference. So I don't know what's happening. Whenever they ask me, like I'm not confident enough. And when they go for interview, they want to see your confidence on your face. Then only they'll get the visa. Right. Yes. I said, okay, I'll just try my best. See, I don't know anything. I'm not a god to decide everything. I just did the filling, but that day I was become more conscious. Like no, इसका बहुत अच्छा होना है. It was really very good, and he was so happy. Literally, he got tears in his eyes. And next day was the interview. Directly from the embassy, he came to my clinic with a sweet box. He said, like, madam, I got visa. See, now I can't say like because of filling he got visa. That boosted his confidence level when he talked to the opposite person. Yes. So when you're hiding and when chup chupake, then maybe the other person may think he is lying or is doing whatever, we don't know. So that is a miracle of this one actually. So that I want. I don't want that time whether the ratio this is big or this is small. No. I want that person to be happy, want to be confident, and anyway that is a temporary one. It's not a permanent. And that we are mentioning to every person wherever we are. Last one? Generally, I tell patients 6 months to 1 year, but we have a testimony of 5 years, 10 years also. It is being posted in Instagram actually. One lady came 10 years old filling, even I was shocked actually. Oh my god, 10 years तक तो बहुत बड़ी बात है. Maintain करना पड़ेगा. या मतलब maintain मतलब क्या है? Girls है, they open nail polish bottle like this. So teeth itself will, yes, they do. Even boys will open the thumbs up bottles or beer bottle, tooth itself will break. So I cannot say my filling is stronger than your teeth. So it can hold the forces, whatever it can hold it, right?
I could see one person tooth was broke.
Yeah, there are many
because
people.
He chewed some after
in
lunch.
Telangana, one festival is there, Sankranti, I mean, you'll be knowing it. They do Shakanalu like very hard. So they bite and they'll come with the broken teeth.
Oh.
And now the Holi was there, they play and they'll fall down. The tooth will break. So in that case, I cannot say my filling is stronger than your teeth. So filling also can break. But for that purpose, for that whatever the thing they're coming, we are going to fulfill that actually. So people are coming and they're going very happily from Vijay Dental.
Wow. That's really, really nice, ma'am. I'm your biggest testimony again.
Yeah, I know you can.
So my transformation.
And for you also, we know how we checked. Because when you visited us, we didn't even know you're such a famous and personality.
No.
We just had a normal conversation.
Yes, we had a conversation.
You just came as a patient and we checked thoroughly. Even now, I use intraoral camera. It's a very simple thing actually. We show them what is there in their mouth, what we did for you also. Then this is the thing and this is the thing you go and need to go for x-ray if needed. Or if we have x-ray also, we do accept it. Then we'll give what has things to be done, what we can do for them or what they want. Because nowadays the people have become really, I don't know what to say. They'll have multiple teeth decay, multiple tooth missing or pain. But they want, I want this teeth gap. So then I'll just give them counseling. Okay, either not here, go to wherever you are, go to the nearby dentist. I don't say come to me only. I never mention. If you see in the Instagram also,
I have seen,
I'll mention visit nearby dentist. I'll mention. So because wherever, at least get it done.
Get it done.
Get treated.
Right.
It is for better. You stop the problem over there. Don't
Right.
unnecessarily prolong
Right.
it.
Right.
That's how I tell people
Right,
actually.
Right. Ma'am, another question that when I was seeing your journey as well when it comes
Okay.
to taking up the braces. You were also wearing the metal
Yes,
braces.
yes, I had
Tell
a
me
braces.
more about it.
Because see, when I was in a college, my parents were not ready for me to go for a treatment because they said like 4 teeth has to be removed. As all the parents
yes,
say, my parents
yes.
was no. Tooth removal, no, I can't agree for this.
Ah.
Okay, हो गया. Then after शादी के then internship में they were like, then अभी शादी करना है, no, don't go for braces treatment because that time awareness was not there. So then again it got postponed. Then after marriage, my husband like, अरे अभी marriage हो गया, like why you want to go for the braces? Again it got postponed. But one fine day, then I just told my husband like, see who will come to me if I am like this.
Correct.
Then he said like, okay, अभी तो बच्चे भी हो गए, wait check चलो
That
चला
time you
लो.
were already a dentist?
Yeah, I had 2 kids by that time. The second son was first 1 year birthday. No. Sorry, I got braces and then I was conceived. So it was a very big thing, you know. People
Right.
will think pregnancy में ये करना ही करना है. For almost for 9 months I underwent treatment. Even I recently I put that photos also.
Yes.
When in between I got a break. So I didn't go. I couldn't go. I mean, during my pregnancy only, I think 1-2 months I gave a break. Then after delivery again I continued. Even for his first birthday I had a braces.
I saw the pictures, ma'am.
Yeah.
And, I was really inspired that how.
That's why I know when people nowadays, people can comment a lot. Like especially I'm getting a lot of comment from my fellow dentists, I can say. They'll tell like, why this one, why not this one? Because I personally know what I feel when somebody comment on me.
Yes.
Whenever I used to go for the marriage proposals before my marriage, they used to comment my teeth only. अरे क्या लड़की अच्छा पूरा अच्छा है मगर उनका दांत अच्छा नहीं है. So just because of that reason I got rejected many before. So like this, but that I can't say that, right? So I can't tell them okay, I'll get my treatment done, wait for the marriage date. Nobody can wait like that.
Correct.
So the same feeling, I know the people who are coming to me, I can feel that pain.
I had the same challenge, ma'am. Like I couldn't
Exactly.
smile, and majorly when I am on the stages as well, people are majorly commenting on my teeth itself.
So automatically we feel that confidence level will go down.
Yes.
Even how much ever you get the spirit from inside, suddenly if that person who told you like that, if they come in front of you, it will become low. Okay, मेरा दांत दिख रहा है, नहीं दिखना.
Right.
So whenever patient comes to me, that's what I feel. No, I want to understand their problem from their aspect. So if they're having a multiple cavities, only the gap, I tell, okay, they come from very far places. I'll tell, okay, now I'm going to do the gap filling. But once you go back to your place, at least get this treatment done.
Yes.
Either root canal or teeth replacement or filling, whatever. Because they come from very far. They can't stay for 1-2 days in Hyderabad. I don't say like every time you come from your place to my place. No, I never say that. You go wherever you are, but get this treatment done.
Right.
I just educate them. I just motivate them to go for further treatments.
Right.
Which is very important.
Very important.
Yeah,
ma'am.
that's. I feel like I'm just spreading awareness actually.
It's very important also, ma'am, because people care about all the external things that they want to show it to the people, but not the oral health.
Yes, exactly.
Right? So, ma'am, this 30 minutes, the treatment that you told, right? When did this all start, ma'am?
No, this I'm doing almost since more than 10 years. It is when this Ivoclar company they started this material. We attended one seminar in Bangalore itself. Right. It was in the year of 2010 or 11. I don't exactly remember, but in those days only. So when I came here, but the kit itself was 60,000 rupees when I bought that time. So everybody was telling me, my friends, "Arey yaar, pagal hai kya? 60,000 rupees mein, why did you get this?" I was like, no, I don't know. Somewhat I liked the way they told there. I just bought it. And that really today, because of that, I'm here.
Wow.
And people are able to identify me. And recently I went to Vizag and one couple shoot was going, a pre-wedding shoot. They stopped the wedding shoot, they came to me, "Oh, Vijay Dental madam. I said, yeah. And so people are identifying me and people are happy because of their smile now. So that's very important.
Yes, ma'am.
I
So
became
how
more
many
busy now.
doctors do you think, ma'am, that they're doing this? Because I don't find many
No,
doctors
actually,
doing this.
everybody can do, but Empress,
People are not
as
doing
of
it.
now, what company people say, because whenever I place order, minimum it takes 1 month for me to reach it, because it comes from Europe actually. It's not an
Oh.
Indian
So
made.
you import it every
Yes,
month?
every month I place the order. I mean, not every month. I'll go in the bulk actually.
Ah.
So whenever I place order, that's what they tell, madam. No stock is available. So only for you it's coming. So now I think they wanted me to go as towards a company, but they asked me for 15 days time in a month. I said like, no, I'm very busy. I can't do all those things. So even they themselves, they tell nobody buy in AP and Telangana. Only you're the one. And once I started this, and a few dentists are placing order, madam.
Wow.
So, but mine is the highest huge order, that's
Yes,
it. It's a
yes,
very huge
yes,
order,
yes,
and even whenever I go for expo also, they really give me a very good honor. Whatever thing, they'll
Wow,
support me.
wow.
And because I attended a workshop in Bangalore around 2010 or 11.
And that is why upskilling yourself is important.
Because that's very good. Because even now I go to Mumbai, and I went to China also, Shanghai.
Yes.
So wherever it is there, even though I've done my BDS, I've upgraded my all the skills in all the department, I can say. So, but what is happening with the new generation is, whenever, see, I don't say like MDS you should not do. You should do MDS whenever you want to go for academically.
Yes.
Because even when
What
you
is
are
the college best for
no, any
this?
college is better. See, I can't say like that. But the thing is, whenever you want to go academically, whenever you are financially afford to go for a MDS, because I was not financially affordable those days, I couldn't go. So I just, BDS I did, but I started updating myself, going for the seminars, going for these, courses and all. So experience matters a lot. Now, what will happen if you once you finish your BDS after like final year, till that time the practice is different, the clinical college is different. So immediately they go to the MDS, they choose one department. So they become pro in that department only. Whatever other 7 department, they leave.
They leave. Why?
But they don't know. No? Like, suppose if you're going for endo, they become proper endodontist. If you ask them to do the extraction, no, they can't do it. So general practice very, very mandatory. So, but I practiced almost in Hyderabad and in Karimnagar, very good doctors actually. So we had a lot of exposure. So then even now, the people who are working under me, they can do anything and everything.
Wow.
It's not like I can't do this, I can't do no. You just name it, they'll do it. The people who are working under me, even people, because generally we don't have a vacancy. If I put, recently I put one Instagram story, morning I put, evening I got 2 MDS, got recruited.
Wow.
So it's like that. So people want to learn, they want some platform.
They want a platform.
Yeah, where the college will teach you some level, some extent only. So like that, I upgraded my skills over a period of time. Now, see, every time, experience really matters a lot. Now it's almost like 28 years experience for me.
Wow.
Working.
Wow, very nice, ma'am. Ma'am, another very interesting question I want to ask you, that people drink a lot of soft drinks, right? Coca-Cola and all of that. And I have heard that Coca-Cola can melt your teeth.
Exactly. Any sweet actually, sugar things are not really good for teeth. Even suppose if you can't avoid it, then the best way you can do is at least brush or rinse your mouth. That's why we tell brush twice daily, morning and night. See, the day start with the teeth. Morning, as soon as you get up, you'll just brush your teeth.
Yes.
And before going to the bed, again, we are going to brush your teeth. It's so important in the life, the morning, start with the teeth, end with the teeth.
How many times should we brush the teeth?
2 times daily is sufficient actually.
People, they say that 2 minutes is enough for you to do brush, right? So
2 minutes is really
what is the
more than
duration?
sufficient.
Okay.
See, it's not, how many times you are brushing, or how long you are going to brush, but how efficiently you are brushing it. If you do tap rappa over na pushpa ka, no rappa here. Politely, it's also one of your part. How do you maintain your skin? You don't do like tak tak.
You have to be
maintain
soft
very softly, gentle.
Yes.
Same way, gently you should manage your teeth and gums. And the main simple technique, with my experience, what I could suggest is, after brushing your teeth, just take your bare finger, massage your gums. That's really a very good tip
Practice.
for to have a healthy mouth, healthy cavity.
health, yeah,
Because when you massage your gums, automatically if this bleeding, it gives an indication. But whenever you brush, you may not touch your gums at all. You get like this, you do. You may not touch your gums. It may not bleed, and you think your gums are healthy, your teeth are healthy. No, and main like roll-on technique. And the way you brush is very, very important actually. It's I don't advise again hard brush. I advise always soft brush or
Soft brush.
ultra soft brush because don't damage
Because
your
we
teeth.
find lot of brushes when we go to hotels or resorts. We find brushes are very hard.
Yeah, no. Always go for soft brush.
So
Soft.
you recommend us to carry the brush from home, is it?
That's better. Always. I too always carry my own brush.
And even when it comes to the brush thing, a lot of Indian houses, so once they brush it, they keep it there and it is open throughout the day.
No, that's very wrong.
And what do you
Actually,
suggest
recently
there?
we posted that also. Always try to cover it.
We get a cap, right?
Yes, we get a cap. Or if the cap is not there, you can just get the ziplock will be there. Just put it like this. You can have that also. Like whenever you travel and
What
all.
happens if we keep it open?
See, if the washroom has got too much of bacteria over there, sometimes the lid will not be closed.
Right,
You can just imagine how this thing aerosols will be there. So better not to keep open in the washroom actually. Or you just keep this brushing kit separately.
Separately in the sense the
Wash
near
it.
the wash basin or somewhere
That's
else.
why the olden days there'll be outside the balcony. I mean, what do you call portico? Not portico.
They don't
exactly.
have restrooms inside the
inside
house.
the
They
houses,
have
outside actually.
Right. That is the reason, right?
Yeah.
So, ma'am, now there is a lot of trend going on, right? That teeth whitening thing has come. So people are using those kits to whiten their teeth.
No, I literally strongly I will say no for all these things. No instant whitening material is available, which is not really good. I can
It's not,
say no. And even online, these aligners and all they go, and at least per day I'm getting 5 to 10 patients. Like I use that.
Yeah.
Don't go for the doctors not online this thing.
Right.
So only I mean, if you can take any tips and all, yeah, okay. But for medication and all, I don't prefer. Especially for dental, though online
Don't
is
do
not
it
at
by
all
yourself.
useful. Yeah, self-medication. They don't know how to wear. They don't know how to place it. But even if you don't know proper flossing, also you're going to damage your gums. So until and unless you don't know, don't do it.
Right.
If you want, you can just go for it. Nowadays, it's very easily available. Like water flosser. Water flosser.
And you recommend water floss?
Water flosser is really good actually.
And how about the stick floss?
Stick floss, if you're aware of how to floss it, it's very good.
Because it creates a gap, is what I
No.
floss.
Floss will not create the gap. Improper flossing will create the gap.
Which you mean
Water
flossing?
flosser is good actually. Just take out all the food, whatever
Don't you
has been
think
stuck
it will
over
push
there.
your teeth a lot?
No, never. See, as long as your bone is healthy, it will not go anywhere. If your bone is not good, even if you take a deep breath also, your tooth can move.
Yes.
Okay,
Yes,
it's nothing can do.
Yes.
It's very strong.
Yes. Also, people use lemon in order to whiten their teeth.
No, lemon is abrasive again. Actually, erosions it causes. Any citric things will cause the erosions. Like you can see the inside, like a convex kind of thing from the inside. Even morning when they have the lemon water, they have a concentrated thing. Right. They'll get all erosions. So one fine day they come, I got a lot of sensitivity. Like they can't take cold, they can't take hot. So lemon and water, if you want to have, dilute and then you can have it.
Dilute how?
This is water.
With the water, okay.
Direct lemon, like don't have.
Right. And
or make sure whenever you're having this lift and then because that should not touch your teeth. Whenever you're drinking like this, they're going to touch your upper the palatal side, the inside like this.
So we should drink it from up.
That's better.
Understood.
If you're really fond of having the lemon water in the morning.
And most of the time people they say that they don't they feel a lot of sensitivity while having sweet things. So what about that?
Yeah, sweet thing, because there will be, see, that is the thing I'm telling you. People know there is some problem. People know that whenever they go to hotel, they'll keep this soap and toothpick over there. They take toothpick, they'll do this and all, but they never think of going to a dentist. See, if you are using any pins or any toothpick itself is an indication you have a dental problem. The next day they can visit a dental, there'll be some cavity or something is there.
Right.
So initially, maybe nowadays everybody is aware of all these ads and all desensitive toothpaste.
Right.
They go to medical shop, they buy their medication by themselves, they apply it, they suppress the pain.
They suppress. And the sensitivity, is it because of the sensitivity that they have? They get the pain while they have
They get
sweets?
but they'll suppress the pain because of the application of whatever blah blah
Right.
blah.
So I have a question here. People say that to avoid the sensitivity, use Sensodyne. Does it really work?
Yes, Sensodyne work actually. That's the main problem. So I can't say any brand like that actually. Any desensitizing paste will work. Suppose cavity is there. Initially it will suppress the pain. But cavity will not stop growing over there. It's an active, it will just go on
So it's like a
deepening.
temporary solution.
Yeah, the cavity is in a triangle shape. The tip is very small. So then, it will be like base is like this broad. So base will be like this. So whenever they apply all over, whatever the toothpaste and all, maybe they'll think, look, pain is not there, then leave it. But cavity is progressive. So it'll become very deep and it will go near to the pulp or onto the pulp. Then one nightmare, they'll get severe pain. Then we tell either go for root canal or remove your tooth. Maybe if they would have come to the dentist or visit the dentist initial days, the simple filling would have saved that tooth, right?
Right. Yes.
So that's why never do these, home
Right.
remedies or
And,
self-medication.
And one more thing, we have heard these ads coming in. आपके toothpaste में नमक है, right? So there are a lot of brands coming in, Colgate and charcoal, many things.
No, I
so
really
what
strictly
kind
I
of,
say no.
What kind of
See, basically it's a sodium bicarbonate. That's what they wanted to say it. See, it's all marketing strategy I can say, but I strictly say no to, all these things. Just take normal, any toothpaste is okay. Just press properly. See, the tooth surface is very smooth. In between the interdental area, the food is going to stuck.
Yes.
So for that, if you do like this, you're pushing your food particle inside. But instead of that, if you try to push it like this, or pull it up, lower
Upwards.
teeth like this, that's enough actually. Hardly 1 minute is sufficient to brush your teeth. And where the neglected part is this lower jaw inside. The people will not brush at all. Just take a mirror, in front of mirror, bend your head like this, check this area. Or go to your dentist, ask them to show in lingual aspect of the teeth, then you can see how much callus or tartar is there. And that's very important, where to brush.
Right,
Okay,
right,
so-
right. So what are the things, what are the myths people have when it comes to oral health?
The common myth is, if you remove your upper teeth, you will go for the eyesight.
I have heard a
You
lot.
will lose your eyes. Nothing like that. Did the doctor said, your dentist said like that? No. Did your eye ophthalmologist said that? No. What is the eye supply nerve? Is optic nerve. Does optic nerve supplies any of the region in the oral cavity? No. Then how come it happens? And my question to you is, simple thing.
Yes.
People undergo this rhinoplasty. This nose is very close to the eye.
Correct.
When they go for this nose, do they get this eyesight problem then?
No.
It should be there. Then when they don't have this one, there's very long distance here.
There's a
How
long
can they
distance,
get it?
right.
It's all myth. It's a
Because
big
I
myth
remember
actually.
when I went for the first time that I had to get the metal brace done. So my mom was completely against removal.
Tooth removal. Same thing happened to me also.
Because they told headache will come and eyesightness will have a lot of things.
Nothing is there. Nothing.
Right. So, ma'am, on the other side, how was the entire journey until now, 25 years?
2024, 23, it's like post-COVID only I started my Instagram actually. So till then it was okay. I used to get only, like when I started I'll tell you, I forgot to tell you this. I should say big thanks to my husband actually, Mr. Gupta, because today I am here just because of him. Because whenever I was thinking about, whether to put a step forward or not, he used to take me along with me. No, you can do it. You are capable of doing it. Because whenever the patient used to come, they used to always praise me, madam, injection, whenever you give injection, it's so painless. You do such a kind, hastavasi, they'll tell.
Yes.
If you do any treatment, it will be healing,
Right.
like that kind of thing. So always used to be supporting. But initial days, I just put one chair, single chair.
Right.
So then my husband told me one word: don't run behind money. It's suppose if the people are coming, if they really need it, only do it.
Right.
So unnecessarily don't do. Once you get the name, money will come behind you.
Correct.
And he is very ethical actually. The same with me also. The people who came to me, they will understand this.
Right.
So in fact, I'll tell some people like, you go to other clinic and then come to me. Openly I give a challenge actually.
Yes.
So when you're open to them, even I see, it's not like I can please everybody, whoever come to me.
Right.
So 10 out of 10 members, maybe one is not happy with my thing. That's not my problem.
Right.
But out of nine members are happy, that is enough for me.
Right. Right.
So
Right.
really the journey is very superb, and now we have got 6 dental chairs in one clinic.
Wow.
Another dental clinic, another branch is 3 dental chairs, and 2 more we are planning also. And for this everything, my husband is a big support. And when we had a small clinic, luckily I got an expansion chance.
Wow.
So that time the rent I used to pay was 9,000. Suddenly it was 30,000 actually. I was like 30,000, no, I can't pay. So you know what my husband told me, and I prefer all husbands should be like this. When your wife is hardworking, or when they want to do something, support your wife. They will really do it. So my husband told me, I was so scared, like if I don't get that money, how to pay rent, how to pay salary, like that. He told me like, okay, you just, how much you're paying now, 9,000. Pay that much only. Extra whatever I'm going to pay for you, don't worry. So that kind of support he gave me. So in any way, any time, and even staff, whenever I want to take them all out also, he only book all the tickets and rooms, everything, like vehicle, everything he'll provide me.
Ma'am, one message for sir.
One message is not enough. One dictionary is also not enough for my husband. No, he's very lovely. Very, it's my luck, I can say. वो बोलते हैं ना, like marriage is made in heaven, like that.
Yes.
Because I was in Karnataka, he was in Hyderabad, and the computer connected us actually. Like one movie came actually that time. So all my friends used to tell me, "Rehna hai tere dil mein," that movie. So it's almost like a same story. So everybody used to know before, like your story. They used to come and tell in front of me.
I saw your son sir dance as well. It really felt like a filmy.
He is very, very good. Like
So sir is filmy.
Yeah, not nowadays also. We love watching movies.
Wow.
We go to theaters and any movie. Like
So ma'am,
we love us.
personal question: who proposed first?
Sir, I think I don't remember this actually. No, I think sir only. Yeah.
Yeah, very nice, ma'am. Ma'am,
So, matlab, when I used to tell him like weekends, mein, log, tomorrow what your plans, like that,
Right.
na? So I just used to chat only, no phone conversation also that time. Actually, tomorrow be like कोई आ रहे देखने के लिए, next पता नहीं क्या होता है. So one fine day, then he told me like, why can't we go ahead? Then I thought like, अरे parents will agree होते हैं क्या? And then I told my parents. By the time, like everybody was aware of his name and all. Like he was called like nickname by Surya. So Surya like that.
Wow.
So then my parents were okay. Let them come to see here. Then my in-laws they came to my place, and my parents went to their place, and then the marriage got fixed.
Wow.
But somewhere my father was not happy. Even their parents were not happy because I don't know what made them think, because we were literally not financially very low.
Right.
My father also used to help everybody. No, not even a own house actually, to be honest. That's why I didn't go to my MDS also. So in that case, in there, like all dowry system is more in AP. I mean that time it was Hyderabad, Telangana was not there. They still in Andhra mein bahut dowry system hai.
Right.
But my husband didn't take any single pie also. He was against dowry. And I got recently my son marriage also. Even we didn't take any dowry. We are proud to say I'm a mother-in-law now actually.
Wow.
So
I saw the pictures and I saw your daughter-in-law. She's very pretty. Very pretty.
Very pretty, very good actually. So that's what we got them married very early actually.
Right.
So nowadays I've seen many people, whatever they get salary, they say like settle. I mean, I have to settle down. What they'll settle down? I don't understand.
Right.
They have a own house. They are getting good enough salary. They have a very good family background. Still, they want to settle down.
Right.
But the time will come. I mean, there is no end to
Settling
ख्वाहिश
down,
के लिए.
right.
Yeah. Then nothing
There's
is
always
there.
a needs coming
the
in.
demand actually. Whenever you don't fulfill the demand,
Right.
then they go for the depression. Then they go for this dissatisfaction. That made finally enter suicidal attempts. That's what
because
I feel
of the
really.
pressure and the stress from
pressure
family.
because they don't. I mean, reach that
Match that expectations.
Yeah, expectations. So never expect. Just happy wherever, whatever you have. Even till last year also, we had a just 2-bedroom flat. So it was a peak actually. We have to expand the house. Because my in-laws, my mother, my mother's sister, everybody, all of us will stay together.
Wow.
But
Very nice.
all happy now. Everybody is very
Very
happy,
nice.
and my husband said also everybody really
Touch wood,
they
ma'am.
give a
Right.
lot of respect and lot of too much of warm welcoming and
Now,
wherever
now
I go.
parents are happy.
But
Now parents are
yeah,
happy.
my father is no more, but my mother is very happy. But my father, before he was dying, also he was just holding my husband hand, and he was regretting by himself because olden days में they used to feel that we'll देखेंगे कहाँ तक जाते हैं because they liked and we just married.
Right, right.
Even though they had a money, they were like, no, you do whatever you want, you be in that only.
What is your one message for parents?
Parents, see nowadays parents they don't give full time to the kids actually. The freedom, it's in the name of freedom, everything is getting spoiled.
Right.
Either in the whatever it may be.
If you can elaborate this, ma'am.
Even now, I mean, I don't know whether I should say it or not. My son is, even though they are married, they don't track I mean, kids, I can say.
Right.
Freedom should be given. I don't say no. Even I do give a lot of freedom. But there is a track for everything. Even my son, whenever we have a family group,
Right.
it is very important. I don't know whether everybody is having it or only I am having it. I don't know.
Right.
Even though my son is married, when I told my daughter-in-law, now I have 3 children, 2 daughters, and you're also like my daughter.
Yes.
So wherever the family group, they have to update wherever they go. Even though they are very far, I know now what he is doing. Where is he now?
Right.
So at least they have that fear. They don't do all unwanted things or blah blah blah. You all know like what's happening in society nowadays. They don't do. Even if they want to have a beer, my husband will come sit with me
Freedom
only. I'll
with
give.
love is important.
Freedom with love is very much
Right.
important actually.
Right.
But tell and do.
Yes.
So no, if you once if you're lying, na, to cover that you're lying once again.
Right.
So like that you keep on lying whole life. So you will one fine day they go for this online gaming, that this and
Right.
all. It's all thing.
Very true.
So be friendly, spend time with them. Even though I used to work, but I should take time for my kids.
Yes.
I didn't practice. I didn't start my own practice till my younger son started his schooling. I used to work only. Because once we open the clinic and once we are there, it will be a lot of pressure will be there. You have to pay rent, you have to pay the staff salary. If you don't fulfill that month, then you'll start the cravings or whatever.
Right.
So which I was against. Whatever salary I'm getting, in that we were happy.
Right.
It was for them also. It was a small school, not a high fund or nothing. Whatever we had, in that we used to ಕನ್ನಡದಲ್ಲಿ ಹೇಳ್ತಾರೆ ನೋಡಿ ಹಾಸಿಗೆ ಇದ್ದಷ್ಟು ಕಾಲ್ ಚಾಚಿ ಅಂತ
right.
ಆ ಥರ ಇದ್ರೆ ಸಾಕು.
Very true.
That's a very
Super,
thing.
ma'am. Super.
Yeah. Unnecessarily, if you want to do that, this. See, nowadays, what is happening? My son also, they got admission. I mean, they were about to give in DPS school.
Right.
So my husband told me one thing. All rich people are there. Now people are going to, one fellow will go to Singapore holiday, next fellow they'll go to New Zealand, but we can't even go to next state. What we'll do in that case? The kids also will feel, no, my parents are not affordable. Right. So we put him in a small school where they used to go to park also, they were happy.
They were happy, huh?
Weekends mein just only one thing we had is we had on Baglimpal Park was there. We used to go to that park and we used to have that murmuralu like something,
Yes.
2 rupees ka, but we used to enjoy that life also.
Happiness is important.
Happiness is very important. Even small examples, if you see the watchman people, they'll be very happy living in a small huts.
Yes.
But people are living in a big houses. Always they're worried about something. They don't know what they want.
Right. Very true. So, ma'am, really inspiring conversation, very insightful conversation until now, ma'am. One last message for people who are listening to us today.
So first thing, thanks to Sujata for giving me this opportunity.
Ma'am, I'm honored. Thank you.
In my place, actually, see, being a Kannadiga, this is my first podcast in Bangalore, which is really like TV shows and all I've given a lot in Hyderabad.
Right.
But in Karnataka, this is my first show and really thanks a lot.
Thank you so
all
much, ma'am.
to my Kannadiga people and Telugu వాళ్ళకి కూడా because ఇక్కడ అక్కడ అమ్మాయి కాబట్టి సో ఇక్కడ పుట్టి అక్కడ వెళ్ళాను సో వాళ్ళు కూడా అందరు కూడా చాలా బాగా చూశారు అండ్ ఆల్ థ్యాంక్స్ టు మై సోషల్ మీడియా ఫ్రెండ్స్ అండ్ మై ఫాలోవర్స్ అండ్ మై సబ్స్క్రైబర్స్ బికాస్ ఆఫ్ దెమ్ ఐ గాట్ దిస్.
Right.
So they trusted me and my work. See, trust is a basic thing. If you don't trust, either medicine will not work, nothing is going to work. Trust is a basic thing you should have, either in the relation or in the business or in the doctor, whatever. See, I don't say there are few people who misuses this also, but always be positive, think positive, try to help somebody. The one Chiranjeevi Garu is my favorite actor. One movie mein he'll tell you make one people help, you tell them to help other people.
Yes.
Like that it should be.
Right.
You in return don't expect anything. The God will only help. The same thing. The God helped me somewhere where I was about to. I thought that was my end, but today I'm here.
Wow.
So never think like put this is the life mein end hai. Suicide jo karna cha rahe, please never do that. There is lot of things to do in the thing. If I have one patient to tell, she is actually Miss Deaf International.
Oh, wow.
She invited me as a guest around 2 years back for a Women's Day. There I saw a couple of women. I really felt, I couldn't say anything there. The people were like that. One movie came, Nagarjuna Garu, he will be on the wheelchair. Same way one girl was there. She's a painter actually. So they thought like government said जो free आता है, they were like no, free में नहीं होना हमको, because we are working for that, we want something.
Right.
Like that, you do your work, the result will come. Never expect free or వాళ్ళేమో చేయాలి, ఇవరేనో నಮಗೆ ಮಾಡಬೇಕು. Don't expect that thing. When you expect the things, when you can't reach that expectation, then you'll become sad. So better not to expect anything. Whatever comes, that is for me only.
Right.
I always feel I am the own competitor for me. Suppose if
that is important.
That's very important. It's not like, see, now my clinic, when I opened, I was the only doctor in my area only. But now my clinic में इस तरफ 3 है, इस तरफ 3 है, आगे 2 है. Almost around 7 exactly आजू बाजू में. I never feel bad because everybody has got their own talent.
Correct.
It's not like somebody's open, but there are few dentists, they only call me, Madam, ikkada pakkana, they opened my clinic. Let them open. What is happening? You trust your work. You be competitor for your work.
Right.
See, mouth to mouth thing, nobody can stop that. That's a very biggest marketing. No social media, nothing. But mouth to mouth, if you are happy, you'll refer another 10 members.
Yes.
If they are happy, they'll refer another 10 members. That is enough. That's what I feel.
Yes.
So I feel I am the big competitor of my work.
Yes.
Today, if I do 10 cases, okay, maybe next month I want to improve my work.
Right.
Or if I buy a good material like this, next time I want to technology mein wise, I want to improve my technology. Like that.
Wow. Wonderful, ma'am. Lot of learning from you, and I'm super inspired.
And all my fellow BDS doctors, dentists, I just want to give one message. Never get discouraged. Never. So always think there is something to do, and there are a lot of things to do actually.
Right.
Any college వచ్చినా, ఎన్ని డెంటల్ ఎంత మంది వచ్చినా కూడా అలానే పాపులేషన్ కూడా పెరుగుతుంది. Population is increasing day by day. It's not same as 20 years back.
Right.
So never worried for anything. What is going to happen? What is there today, that you enjoy. For tomorrow, whatever, God has already given a destination. Right. That really I feel because I was in one remote area near Bangalore.
Right.
I never thought of crossing Bangalore, but I went to Hyderabad and framed all over the here and there.
Right. You started from scratch.
God has given me the destination point already.
Yes.
The path also is going to take us. So just stay tuned, keep calm, that's it.
Right.
So unnecessary worry and thinking that there's too much of worrying, nothing is going to happen.
Very true.
Not to worry, that's it.
Right. Wonderful, ma'am. That's a wonderful message. Yeah. So, guys, now we are just done with the podcast with Vijay Lakshmi, ma'am. And she's a celebrity dentist. And in this conversation, in this podcast, we have spoken a lot about ma'am as well. The personal side of ma'am, we have spoken a lot. And we have spoken something that we usually don't talk on internet. And most of the dentistry, they don't usually talk about it. This entire podcast is for 1.5 hours, almost 1 hour 15 minutes. Watch this podcast. This will really help you a lot. It will bring a lot of awareness in you. So, ma'am, thank you so much
Thank you so much.
Thank you so much for being a guest, ma'am. I'm super honored.